This is a 51-year-old female who was diagnosed with an estrogen and progesterone receptor positive lobular breast cancer. I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist, and this is a made-up case to illustrate an important point. She underwent yearly mammograms, and this year's mammogram showed what we call architectural distortion, and you can see that the tissue where the arrow is pointing looks a little bit different from the surrounding dense breast tissue. She had an ultrasound which looked like this, which showed a vaguish mass hiding in some dense breast tissue. She had a biopsy using the ultrasound, and it showed that she had invasive lobular cancer, grade 2, estrogen receptor 30%, but progesterone receptor was 85%, HER2 receptor was 0, and Ki67 was 10 to 20%. She had an MRI which showed that the mass was 1.7 centimeters and she didn't have any other spots in that breast or the other breast, which looked concerning. She had read that having estrogen and progesterone receptors was a good thing, but she didn't really know what it meant that there were more cells that had progesterone receptors than estrogen receptors, so she asked her medical oncologist. And they talked about this study, which was published in November of 2023, looking specifically at lobular breast cancers and the relationship between estrogen and progesterone receptor status and how well people do, how long they live without seeing their cancer come back. The study included 707 patients with invasive lobular cancer and found that when patients had a lower percentage of cells which had progesterone receptors, they had worse disease-free survival compared to those who had a lot of progesterone receptors, meaning that progesterone receptor status is an independent predictor of outcome. So people who have more progesterone receptors are more likely to live a long time without their cancer coming back. She felt very reassured hearing that news, and the medical oncologist told her that then she would benefit from taking a hormone-blocking pill for 5 years, and she opted for a lumpectomy, radiation, and the hormone-blocking pills. 10 years later, she's still cancer-free.